Hi. We are presented here today with a clinical scenario whereby an elderly man in his 60s, diagnosed with primary open-angle glaucoma, attends an eye clinic with his daughter to seek help from an orthoptist in regards to his vision. Throughout most of this patient's appointment, some ethical issues arise. To address some of these issues, we will be playing out this scenario to show how good practice should be applied. Jessica will be playing an orthoptist, Mervyn will be the patient, and Tina will be playing the daughter of the patient. As the narrator, I, Naomi, will be guiding through what good clinical practice should look like.
Hi, Mr. Tan.
Yes, that's me.
Hi, my name is Jessica. I'm an orthoptist here at La Trobe Eye Centre and I'll be assisting you today. How are you feeling?
I'm fine, but my daughter insisted that I come for a checkup.
Hi, yes. I think my dad's been having some eye problems, so I've been pestering him to get it checked out, but he's been pretty stubborn about making the appointment.
So how long have you been dealing with these issues?
I told you, my eyes are working perfectly. My doctor thinks I should be here, but he doesn't know what he's talking about.
He visited his GP a while back because my dad's been tripping and bumping into things that seem like they would be in his sight, so they suspected that it could be some kind of hindered vision. I wasn't there for that appointment, and my dad refuses to tell me any more than that, so I hope that you can help him today.
Okay, not a problem. I will take a look at him today and we can find out what is exactly happening. Will you be accompanying your dad during the consultation?
Absolutely not. She's staying here.
Okay, that's fine. I'll just wait in the waiting room. If you need me, I'll be here.
Okay, we won't keep you waiting too long. Come with me, Mr. Tan.
The orthoptist proceeds to take Mr. Tan into her office for further discussion and testing. So far, the orthoptist has introduced herself to Mr. Tan and has made him aware of how the appointment will be carried out. And ultimately, this displays a good form of communication with the client.
Okay, I've just had a look at your referral letter and from the results your GP has taken, your vision seems to be declining. The results show that you may be unfit to drive. I'd like to do some further testing today to see what the issue is. Is that okay with you?
Fine, I will do some testing, but you are not going to find anything. I can drive perfectly fine, and my daughter is just worrying for no reason.
Okay. We'll be conducting a couple of tests today. I will start off with an eye pressure test and move on to a visual field test. I will then guide you through both these tests and we can figure out if there are any problems to address. So, Mr. Tan, the results show that you have primary open-angle glaucoma, which could explain why you've been bumping and tripping into things, as your daughter expressed to me earlier. This condition is usually caused by an increase in intraocular pressure, damaging the optic nerve. In open-angle glaucoma, the angle in your eye where the iris meets the cornea is as wide and open as it should be, but the eye's drainage canals become clogged over time, causing an increase in internal eye pressure and subsequent damage to the optic nerve. Do you understand what I'm saying?
Yeah, I guess. So is it good or bad?
Your condition is quite serious and you will need treatment. But I'm glad you understand what I'm telling you. That's good. I know that this information can be quite a lot to take on.
Treatment? You have no idea what you're talking about. Nothing is wrong with my eyes. So if that's all you have to say, I'd like to leave now.
No, I can't let you go just yet. I still have a few things I need to discuss with you. Luckily for you, your daughter noticed the warning signs before it was too late, so you'll be able to be treated. There are many effective and different treatments for open-angle glaucoma that are designed to lower the eye pressure. So we have two options here, surgery or eye drops. It's completely up to you.
Now, although the orthoptist had informed the patient of the testings she would administer, consent was not fully applicable here. The patient was not entirely aware of the risks, benefits, and alternatives of the given procedure. Furthermore, we saw the information about the diagnosis and condition being discussed with the patient in a way they could not comprehend. She did not allow time for the patient to process and understand the condition he was facing. This was clearly displayed by the patient's hesitance and signs of distress. Essentially, this goes against the ethical principle of having informed consent. And in any given healthcare situation, a clinician is required to inform the patient of the procedure and diagnosis in a clear and straightforward style.
Treated? Treated for what? There is no way I'm getting surgery.
Okay, that's okay. It's completely up to you. So I guess we'll stick to the eye drops. Basically, the eye drops will lower the eye pressure by either slowing the formation of the fluid inside the eye or by promoting better drainage of the fluid. But the treatment has to be used regularly every day to be effective. It may cost more in the long run than other forms of treatment and may have some side effects.
You don't understand. I still don't think there's anything wrong with my eyes. All this talk about treatment is making me feel nervous, and I don't like that. All your medical jargon is just an opinion at the end of the day, and I have my own.
Mr. Tan, please calm down. You're extremely lucky that you came in today because your case of glaucoma is not at a serious stage. So if you could just make my job easier by listening to me, I would really appreciate it. Although eye drops are an option, I believe surgery would be the best option because there are guaranteed no complications. I promise you that.
As a clinician, it is imperative to always maintain truthfulness with the patient. Although the news may be difficult to hear and may cause distress, it is unethical to dismiss, alter, or withhold information about their health. By doing this, it can cause serious problems for the patient and also the clinician's practice. Moreover, it is unethical to promise or guarantee anything to a patient, as clinicians have a duty to do no harm or allow harm to be caused to a patient through neglect, otherwise known as non-maleficence.
Then why did you tell me it was serious in the first place? I'm getting old, you know. Do you think it's fun just to scare me like that?
Well, you see, I just believed that initially, but I guess I might be wrong. I apologize for scaring you, but I'm just trying to explain your condition thoroughly so you can understand what you're going through. At this stage, your condition is not as serious as it could be, but if the damage worsens, the glaucoma can cause permanent vision loss or even total blindness within a few years.
So, it's fine, right?
No, it's not fine. Have you been listening to what I've been saying this whole time? But yes, it is not serious right now, so you shouldn't worry. Is it okay if I call your daughter in to explain to her about your diagnosis?
What? Why does she need to be involved?
Because I think it'd be best if she knows and you're legally not allowed to drive due to your eyesight, as it does not meet the requirements to drive safely on the road. Drivers with your condition have reduced peripheral vision, which may prevent them from seeing cars close to them when pulling in or out of traffic or when overtaking. Also, you may not be able to see cyclists or even pedestrians stepping onto the road. From this point on, you can no longer drive and will need someone to assist you. I cannot express how important it is.
No, listen to me, okay? I don't want you to tell her anything at all. I can drive myself perfectly fine and I haven't had any issues with my eyesight. If there's nothing more, I would like to head back home now.
Okay, well, that's all for today. Let's head back to reception and we'll finalize a few things and then you're good to go. Please wait at the reception area until the results are ready to be sent to your GP.
Instead of being cooperative and explaining the process, the orthoptist tries to accelerate the process by saying there are no complications and that the surgery is not serious. As a clinician, the orthoptist has a moral obligation to take time with the patient and complete a consultation appropriately. If a clinician decides to rush through a consultation, important information can be left out. And this goes under the ethical principle of non-maleficence, as clinicians have a responsibility to reduce unnecessary harm towards a patient.
Hi, is it alright if I talk to you in private?
Yes, of course. What is it that you'd like to speak about?
About my dad, was there anything I should be concerned about? He's told me that nothing's wrong, but I refuse to believe it.
I'm sorry, but your dad asked me not to disclose that information with you.
Please, I'm his daughter. I need to know. I'm really worried about him. I know that he won't tell me himself, so this is my only opportunity to hear for myself and help him.
Well, because I am concerned about your dad's well-being, I think it'd be best to tell you. Based on the testing we did today, his condition is becoming more serious if untreated. He has a condition called open-angle glaucoma, and I would suggest that he accepts the treatment as soon as possible, as I only want the best for your dad.
What's going on here?
I just had a word with your daughter about your current situation. Please understand that we both have your best interests at heart, Mr. Tan.
You had absolutely no right to tell my daughter any of this. Can't believe this. I'm leaving.
In this scenario, there is a conflict between beneficence and autonomy. The orthoptist is trying their best to try and provide care that is best for Mr. Tan. However, this is not met with Mr. Tan's compliance. Mr. Tan, as the patient, has his rights to whether he pursues any treatment, and this cannot be forced upon him. However, if he continues to refuse any treatment, then he should not be able to drive, as it puts other drivers at risk and thus endangering the wider community with his condition. If the orthoptist was to follow the codes of ethics, maintain the patient's autonomy, and respect their decision to not disclose their medical information, a way the orthoptist could bypass this conflict is to provide the daughter with helper care instructions, but not the details of the diagnosis. She could simply suggest the daughter to drive him around and not let him do it himself. The personal relations between the patient and the daughter should be left between them to be resolved. Ultimately, it is important that we center our practice on ethical principles to ensure we meet a professional level of work. Elements that contribute to ethical practice include autonomy, informed consent, beneficence, non-maleficence, justice, truthfulness, and confidentiality and privacy. All these should be applied in a clinical setting to achieve trust, accountability, mutual respect, and safe medical care.